Now this is really cool. A new study has revealed that a liquid form of medical marijuana may help people with severe epilepsy. The study included 213 child and adult patients with 12 different types of the disease. The new treatment is aiming to fight types of epilepsy that can cause intellectual disability and also lifelong seizures. Jose, this is really interesting because we're seeing a healthy, natural alternative to pills and things of that sort. I'm sure you're passionate about this.
I'm very passionate. I think that it's great that we're not only exploring the recreational aspect of the marijuana debate, we're also seeing now with scientific proof that the medical component that has been around for almost a decade, it's real and it's worth exploring. First of all, let's talk about these kids are not getting high. We need to take away the stigma of getting high. These kids are not getting high. I'm going to tell you why, because marijuana has two compounds. The first one, THC, is the one with psychedelic properties, is the one that gets you high. Now we're dealing with CBD, this compound that is the one with the most medical applications. It's an anti-inflammatory. It has proven that helps, like we're talking about, epilepsy, but also with some forms of cancer. So I am really, really excited about what the future holds in terms of real medical advancement in the usage of marijuana.
Me too, Jose, me too. For those who are skeptical, of course, here are the numbers. They took the doses, right, every day, daily, for 12 weeks. Among the 137 people who completed the study, the number of seizures fell by an average of 54%, which is huge.
It is huge, more than half.
More than half. That is crazy, especially if you are, let's say, a young kid and you're suffering from seizures daily. That'll just change your life. I have a quote here from Dr. Scott Stevens, who's a director of advanced clinical experience in neurology. Here's what he had to say to this. Prior to the study, there were mainly anecdotal reports and very few formal studies evaluating cannabidiol, a component of cannabis in treating seizures. These results stand as a stepping stone towards further studies evaluating the use of marijuana in the treatment of epilepsy. So he's kind of saying what you are. This is the beginning, and it's promising that we're using something like cannabis.
And it's great. I mean, all of this started out a few years ago with Charlotte Figi, this girl that won a case in court to be able to be treated with marijuana. Then Charlotte's Web, it's both a strain of marijuana and the name of this compound that is used to treat epilepsy. I think it's amazing that we finally are getting the proper legislation that will allow for further studies on the properties of marijuana, and then we don't have to rely on big pharma. That today, if you go through that route with chemicals and trademark drugs, the amount of side effects and experimental drugs that they are using so powerful to prevent these seizures, and the fact that we have this natural plant that we can harvest to cure these diseases, and it does not need to be trademarked or sold with, with a markup, I think is great.
Yeah, the only thing that they were suffering from as far as side effects goes, and I have to say that only 10% of the patients experienced this, the worst was drowsiness, diarrhea, tiredness, and decreased appetite, which still, considering only 10% were affected by it, and also those in itself, that's nothing compared to what you might experience taking a harder drug.
The quality of life, the improvement in the quality of life of these families is proven. Today, their families are moving to Colorado so their kids have access to these therapies because it's real, it's happening, and I don't think they want to be able to stop it.
I hope not. Let us know what you guys have to say about all this, the whole alternative natural medicine thing. We want to know. Please comment. And of course, if you haven't already, subscribe to the Lip TV too.